Hi, in this review I will try to summarize with you the anatomy of the blood vessels. We will see together that the blood vessels can be initially classified into three major categories, and those are arteries, veins, and capillaries. And then we'll go from that into understanding that there are big arteries, and these will be elastic arteries, and then we have muscular arteries, and then we have arteriols, and the same thing in the veins. We will have venules, and then we will have the veins. So we'll talk about special classification later on, and what distinguishes an elastic blood vessel from a muscular blood vessel, what distinguishes an arteriole from an artery, when do we call an artery an arteriole, and then we will talk about the capillary beds and the capillaries. So we will see the structure and how is that relating to the function of the arteries and the veins, and then we will talk about the different types of arteries, different types of veins, different types of even capillaries. We have capillaries that are not leaky, are very tight, and those which have little holes in them, and we call them fenestrated capillaries, and those who have very large holes, and we call them sinusoidal capillaries. So initially, let's just appreciate the fact that we have three different types here of blood vessels. Arteries, these are carrying the blood away from the heart. Veins, those are carrying the blood towards the heart. And then we have the capillaries. The capillaries have the very important task in performing the exchange of nutrients, of gases between the blood and the tissues. And therefore we need their walls to be very thin. We only put a very thin layer of endothelial cells with one basement membrane layer, and that's it. We don't have muscle layer, we don't have fibrous connective tissue, because all of these things will make it very hard for you to exchange nutrients and gases between the blood, which is inside the blood vessels, in this case the capillaries, and the tissue in the interstitial space. Sounds good? So as I said earlier, here are your three types. You will realize here is the artery, and here is the vein, and here are your capillaries. Now let's look a little deeper into that. You will see immediately that the artery has lots more of smooth muscle layers. And the reason for that is the same reason when you have a high pressure hose. You will see it's reinforced maybe with steel, reinforced with harder plastic, in order for it to sustain the enormous pressure inside. Well, this is pretty much the case here, except for the fact that these are dynamic. That means they are capable of contracting, as you have learned in the muscle chapter. They're capable of contracting and relaxing, and therefore the lumen, which is the opening of your blood vessel, is capable of getting larger and getting smaller. Okay, so you will see in the arteries we have much thicker layer of muscles versus the layers we see in the veins. Why is that? Well, the pressure in the arteries is really high, 120 during systole and 90 during the diastole. That's above the atmospheric pressure, whereas in the veins at best you have maybe 4 or 10 millimeter mercury, or even if it goes to 20, that's not really much. It still is very low pressure, so you don't have much of muscle layers there. However, you do have a muscle layer, and we will realize in a little bit that the muscle layer in the veins are capable of also performing a contraction. We call that venoconstriction. Veno is vein, constriction is making it smaller. And we will see that this is a very important task that the veins are capable of doing in order to push the blood that is otherwise lingers a little bit longer in the veins into the circulation faster, and that's what we call the blood reserve. It's not like the blood does not really circulate, but once these veins are wider, then the blood will circulate slower. If you make it tighter, then the blood will circulate faster. And we will see in a little bit that about 60% or 65% of our blood is in the veins, and that's our blood reserve. And this is very important when someone has a hemorrhage or dehydration and would like to get some of this reserve back by constricting the veins, and therefore the blood will circulate faster, and we'll see that in a little bit. So this is just a simple comparison between the two, and the first thing you see here is the muscle layer is much more when it comes to the arteries than that of the veins. Sounds good? Let's talk about the layers that makes the blood vessels. We'll see that we have different layers: outer side, outer layer, middle layer, and inner layer. Well, anatomists like fancy terms, so we're not going to call them outer layer, inner layer, and middle layer. We're going to call it tunic. So the tunics, which are the layers, will be classified into tunica externa, that's the outer layer, and then tunica media, that's the middle layer, and tunica internal, that is or intima, that is your very inner layer. Okay, so let's look about on the tunica externa first. The tunica externa will be connective tissue lining the blood vessel from outside. Well, why would you want connective tissue there? Well, you don't want your blood vessels to be loose. You need to connect it to the structures around it. It's also going to house your nerve supply to these blood vessels, because as you know, the blood vessels receive sympathetic innervation in most cases, and you would like to tell the muscle fibers, to the smooth muscle fibers we have, to increase or reduce the contraction, and so you want the tiny little nerve fibers to be embedded in some kind of connective tissue, and that's what we call the tunica externa. And at the same time, you would like to anchor the blood vessel into the surrounding structures, because you don't want it loose and start getting tangled and stuff. So you want the tunica externa. And in the really big arteries, in addition to that, and the veins, the big blood vessels, we will realize also that the tunica externa will house blood vessels, teeny little blood vessels. And the blood vessels there, their function is to feed the big blood vessel. So you can see here an example of that, having teeny little blood vessels here in the tunica externa, and their function really is to feed the blood vessel. I mean, these are smooth muscle fibers, and they're not gonna feed from the blood they're carrying, but they're gonna feed from the blood capillaries and teeny little blood vessels that are embedded in the tunica externa. Well, those blood vessels here have a name. These tiny little blood vessels have a name, and we call that the vasa, blood vessel, vasorum, so the blood vessel that feeds the blood vessel, vasa, vasorum. Get that? So that's our first layer, the tunica externa layer, which is connective tissue to anchor the blood vessels. Right? It doesn't really offer much support to the blood vessel, very little support at that point, but the important is it offers support by anchoring the structure, not like hydrostatic support to the blood vessel itself. It's going to house blood vessels, and we call these blood vessels vasa vasorum, and it's going to also house some nerve fibers, and those nerve fibers are very important in feeding the smooth muscles, the sympathetic innervation. In very rare cases, we will have direct parasympathetic innervation to these smooth muscles. Sounds good? That's our first layer. The second layer is what we call the tunica media. So it's the middle tunic, or the middle layer. And the tunica media will be consistent of mainly smooth muscles. And in addition to that, and it depends how many layer of smooth muscles, we'll see, for example, in the arteries that we have tons of these, and they get lower in the arteriols. If they go 6 or below, then it will be considered an arterial. How many layers of the smooth muscles we can pile them from in out next to each other. Now you will see also immediately that the vein doesn't have that much smooth muscle layers, and we agreed to this. It doesn't have much of a resistance inside it in order for it to proliferate the way that these smooth muscles proliferated in the arteries. Okay, so these are smooth muscle fibers. They are dynamic. They're capable of contracting and relaxing. Contracting will cause constriction of the blood vessel. Relaxation will cause dilation of the blood vessel. And then we have, of course, our elastic fibers. And the elastic fibers distribution will really vary. So we have elastic fibers that form 2 layers, separate layers. One will be internal and one will be external. And that will be specific to a kind of blood vessel like the muscular blood vessel. Whereas in elastic blood vessel, we will see that there is no specific layer really for the elastic fibers to form, but the elastic fibers instead will be embedded among the smooth muscle layer. Okay? So, why do we have elastic fibers? Well, let's go back to the connective tissue chapter. If you remember, we said that there are different kind of connective tissue fibers. We have the collagen, we have the reticular, and we have the elastic. The nice thing about the elastic is that they are like rubber band. You stretch them, they fight back. We call that the elastic recoil. And that's very good because if the artery gets stretched, and they do get stretched, then you would like that elastic recoil to bring back the artery and push the blood forward, right? We know from physiology that when you stretch smooth muscles, then the smooth muscles will contract on their own, and we call that myogenic contraction. So stretch smooth muscles, stretch these muscle fibers here, and then they will contract, and that's what we call the elastic recoil. And that will be very, very important in places like the aorta and in the major arteries, because it's the elastic recoil, by the way, that maintains your diastolic pressure by pushing the blood forward even as the blood is not contracting. You want some force to keep pushing the blood forward to all the way to the arterioles, to your capillaries, and that will be the elastic recoil of your arteries and arterioles. Sounds good? Okay, so the very last layer, which is the tunica intima or the tunica interna, and the tunica interna, tunica media, is made by endothelial cells. These are flat epithelial cells, specialized epithelial cells, and they're very tight with each other, except in the capillaries. You can have occasional small little holes, and of course we have different types of capillaries, the ones that have bigger holes and more frequent holes, and we'll talk about that later on. This endothelial lining will have a basement membrane, and that's what we see here, what we call subendothelial layer. And these are our layers of a blood vessel, of a generic blood vessel. So again, tunica externa, that's connective tissue fibers, and we understand the vasa vasorum and the presence of sympathetic plexus, sympathetic innervation around the blood vessel. And we understood also that we have the tunica media, and that can have, may or may not have, elastic component. You can see the elastic component here in the artery, but you don't really see it in the vein. And we see then the tunica media, or the tunica interna, or tunica intima, intimate with the blood. And the tunica intima will have your endothelial lining and the basement membrane. Sounds good? We'll see that the capillaries, on the other hand, don't have the tunica externa, and they don't have the tunica intima. They only have the tunica interna, or they don't have, I'm sorry, the tunica externa or the tunica media. They only have the tunica intima, or what we call the tunica interna. Okay? All right, so this is what we talked about earlier, the tunica externa and the presence of what we call the vasa vasorum. Remember those terms. Anatomists like the terms. So vasa vasorum is blood vessel or blood vessels feeding the blood vessels, and they are present in the tunica externa. Now the tunica media, we agreed that it has the smooth muscle layers, and it also has your elastic fibers, and the elastic fibers will vary depending on the type of the blood vessel. The tunica intima or interna, on the other hand, will have endothelium, which is a simple squamous epithelium, and it will have the subendothelial layer of areolar connective tissue that makes the basement membrane of your blood vessel. Sounds good? Of your endothelium. All right. So here is a microscopic, here's an actual picture of an artery. So here we have the lumen of the artery, and we have some blood here coagulated while we're processing this. So we have the tunica intima here, and then we have the tunica media, and then we have the tunica externa. We see the tunica externa is just a bunch of connective tissue. If we would make it the picture a little more, if we zoom in a little bit, we will see the presence of teeny little capillaries and blood vessels here in the tunica externa, and these are very important to feed those walls, to feed the artery and to feed the veins. Okay? All right. And I would invite you to study this comparison between the artery and the vein after you have studied the chapter, because that summarizes a lot of things for you, but there are a lot of things that we haven't covered yet, so I'm not going to go over this yet, but let's keep going into the different types of blood vessels then. So first we'll start with the arteries. We'll realize that we have three different types of arteries: the elastic arteries, muscular arteries, and the arterioles. Let's have a look here at the arteries. We'll see first here that we have the elastic arteries. Again, we have the tunica externa, tunica media, tunica interna, right, or intima. And we will see that the muscle layer in the elastic arteries will have tons of elastic fibers, but the elastic fibers don't take a layer on their own. They are embedded with the muscle layer. Okay? Where do we have that? In major blood vessels, like in the aorta, for example. Why would you have that? Because you would want this major blood vessel to have elasticity. What is elasticity? It's the rubber band effect. You stretch something, it fights back with even more power, not like passive power, like the rubber band. Why is that? Because if you stretch the elastic fibers will pull back, but at the same time also these muscle fibers will constrict, will contract. Okay, so that's the elastic artery, and again, the distinguishing characteristic of an elastic artery is the fact that the elastic fibers are embedded within your muscle layer. Now, the muscular artery, you will see that we have the smooth muscle layer here, but the elastic fibers made distinguishing two layers. Now we call that internal elastic lamina and external elastic lamina, and almost no elastic fibers in between. So the elastic fibers have split into two separate lamina and sandwiching in between the smooth muscle fibers. Okay? And we call that muscular artery. Now in an arteriole, you will have 6 or more or less layers of smooth muscle layers, circles of smooth muscles, and you don't have much of elastic anymore. You are relying more really on your smooth muscles, and you still have, of course, the tunica intima, and you will have the tunica externa with that. Okay, so these are the structures of the arteries, and the veins don't hold much of the structures, the differences between them, because the function of the vein will always be the same, to bring back the blood into the artery, and there isn't much pressure in it, so you don't really see much of a change in the smooth muscle layers. You don't need elastic layers. What we will realize in a little bit, that it's a major characteristic of the vein, is the fact that the veins are the only blood vessels outside the heart that have valves in them. We'll talk about that later, but right now we are focusing on the arterial side. Okay. So again, an elastic artery will have, in the tunica media, will have the elastic fibers. How do we know it's elastic fibers? See the thing that looks like a zigzag line here. All of these are elastic fibers. Now in the muscular artery, you will see the elastic fibers are not really embedded with the smooth muscles, but they form layers. One is the internal elastic lamina and the other one is the external elastic lamina. Whereas in an arteriole, you see the smooth muscle layer, but you don't see much of the elastic layers. Get that? So that distinguishes our arteries from each other. Again, the elastic arteries, these will be the largest, like the aorta, like the pulmonary artery, the brachiocephalic, we'll talk about these guys, the common carotid and the subclavian. All these names we will cover together. Don't worry about the names. And most examples are the ones close to the heart. Why is that? Because that's where the high pressure is. You would like to have the elastic fibers where the pressure is highest. Okay? So again, the advantage of having the elastic fibers is that they will recoil, and you stretch them, they recoil back like a rubber band. And this rubber band effect will be very important in maintaining the blood pressure during diastole, when the heart, or the blood flow rather, when the heart is not contracting. Your blood pressure doesn't drop to zero. You still have some blood pressure, or else, if you think about it, if you don't have this kind of elastic recoil, then your tissues will only receive blood supply during the contraction of the heart, but not when the heart is relaxed, and that's a problem. That means you get oxygen, and then few seconds later, no oxygen. I mean, fraction of seconds. No oxygen, and then oxygen, you will get intermittent oxygen, off, on, off, and that's not very good for your tissues. You would want the blood to continue to flow, whether the heart is contracting or in the state of diastole. Okay. The muscular arteries, on the other hand, as I said, the elastic fibers will split into what we call internal elastic lamina and external elastic lamina, and both of them will sandwich your smooth muscle layer. Okay? Now, the arterioles, on the other hand, have less than 6 layers of smooth muscle fibers, and those are circles of smooth muscles. And they don't have much of elastic fibers. It's not needed at that point anymore. They receive sympathetic innervation, and that will cause their constriction. We call that arteriolar constriction. And only in the genitals they will receive parasympathetic stimulation to cause vasodilation, but only in the genitals that you have the direct parasympathetic effect, or the direct parasympathetic innervation to the arterioles. Okay? Capillaries, on the other hand, they are the smallest of all the types, and they do not have tunica externa, they do not have tunica media, they only have the tunica intima, and it really depends on the different type of capillary, as we will see. How continuous is the endothelial cells? Does it have little holes? Is it continuous? Has no holes? We call that just a continuous capillary. Or does it have holes? And we call that fenestrated capillary. And whether it has large holes, and we call that sinusoidal capillary. So we will have different types of capillaries. Regardless of the type, the capillaries are the only place where the exchange of nutrients and gases will happen. Okay? And so that's why we limit all those layers. It's not needed, but also it will hinder your diffusion and transport of nutrients and gases from the blood to the tissue. Okay, so at the capillaries, that's the place where the exchange will happen. Now, the capillaries, let's go to the picture, it's easier to explain it to you. The capillaries are arising from, of course, the arteriole. Here is the arteriole, and the arteriole will give you something here called meta-arteriole. Meta-arteriole, like meta after metaphysics, beyond physics. So the beyond the arteriole is this guy. And this meta-arteriole will have a sphincter, and that will control whether the blood really will go to what we call here the capillary bed or not. Further, the sphincter here is, of course, smooth muscle layers. Now, if you look at the structure here, if you continue with the meta-arteriole, you will realize that it actually continues further and goes forward to connect to the venous end, right? This channel here that connects the arteriole to the venule, we will call that thoroughfare channel. That's the highway that the blood can take if you prevent the blood from going to the capillary bed. Some of you will say, wait a second, can you prevent the blood from going to the capillaries? Yeah, you bet. If you don't want to, let's say you're not really using this tissue, will be a waste to give the blood to this area, because this area here does not really require much oxygen because it's not active. You're not contracting the muscle. You don't need the oxygen. Right now you need little, but not much. And you don't need that much nutrition, so you would rather push the blood straight from the arteriole into the venule, and we call that thoroughfare channel. Now the thoroughfare channel, what controls the blood whether to go straight into this highway or to go into the capillary bed, is those little smooth muscles here, and we call these guys pre-capillary sphincters. Pre-capillary sphincters. Now these pre-capillary sphincters will allow or disallow the blood to go through those capillaries, and therefore it will end up in what we call the capillary bed. So, anatomically speaking, here's what we're looking at. We have an arteriole and we have a venule. The arteriole will give you meta-arteriole. The continuation of the meta-arteriole is what we call thoroughfare channel. The thoroughfare channel is going to connect straight the meta-arteriole into the venule. Sounds good? Now, arising from the thoroughfare channel, you will see, or the meta-arteriole, you will see the capillaries, and you can control the flow of the blood from the thoroughfare channel to the capillaries by what we call pre-capillary sphincters. Do you have another sphincter here? Yeah, we call that the meta-arteriole sphincter. So we do have a sphincter here that can control the blood from going all into all this structure or not. You can control that. Sounds good? Okay. So now we get to the types of the capillaries. As I told you earlier, it will depend how tight the endothelium. Remember, the tunica intima is made by endothelial cells, and those endothelial cells are simple squamous epithelium, and how tight they are to each other, it will determine whether they are continuous. Those are the capillaries. Continuous, fenestrated, that means they have holes like the ones we have in the kidney, for example, in your glomerulus. We're going to study that when we get to the renal anatomy or the kidney anatomy. We call that fenestrated. Or does it have larger holes like the ones we have in the liver, like the ones we have around the pituitary? Why would I have larger holes? Because I would like proteins to come in and out at that point. Little holes are not going to be enough for the protein. So if I want the liver to do its function in whether secretion or dealing with the proteins that are in the blood, then I would need larger holes. And the same thing, some of you are saying, well, what about the pituitary? Well, the pituitary is secreting to you hormones, and those hormones are actual protein. It's large polypeptide chains, and it's not going to be, the small holes are not going to be enough. So you need larger holes around the hypothalamus and around the pituitary in order for you to get those hormones into the bloodstream. So again, the types of the capillaries will be continuous, right? Look at this. Here is the endothelium, and here is the basement membrane, and you can see that there aren't really that many holes in between. Now, of course, if you increase the pressure here, then those gaps will get wider, but we're talking about the normal situation. Whereas fenestrated capillary or endothelium is like what we have in the glomerulus, and you can see here a sinusoidal as having a much larger, even the basement membrane, pieces of it have disappeared, and that will be very critical for the exchange of molecules like your proteins, for example, between the bloodstream and the tissue surrounding it. Okay, veins, on the other hand, are the blood vessels that drain the capillaries and return the blood into the heart. So you start with venules. Remember, arteriole is a small artery, venule is a small vein, right? The pressure inside the veins is much lower than that in the arteries, so you don't really need elastic tissue. You need very few layers of smooth muscles because the pressure is not that much. Nothing will fight you. So if you want to constrict, you can constrict. And so at rest, when the body doesn't need the blood, then the blood, it's not like it will stop. No blood stops. The blood continues to flow. But if these blood vessels, the veins, are wider, then the blood is going to linger a little bit longer in your veins. And that's what we call the reservoir, the blood reservoir. So the main blood reservoir you have is your veins. Now, if you are in dire need of blood during exercise, dehydration, hemorrhage, hemorrhagic shock, any kind of shock, then you will constrict the veins, and that will allow the blood to circulate faster. Get it? So don't think that, you know, the blood will go in the veins and you're not going to use that. It's almost like the bank. You put the money there and you don't have to use it. You will use it when you need it. No, it's not like that. It's just going to linger a little bit longer than normal, or than the emergency situation where you want the blood to keep circulating fast, and that's where you would constrict the veins in order to allow the blood faster circulation. Sounds good? All right. So the venules, on the other hand, are the smallest of the veins, and that's the place where white blood cells like to, from the capillary and the capillaries right before the venules, the white blood cells can migrate from the blood into the tissue. We call that diapedesis. You may have studied that in the physiology. And veins, on the other hand, they're much larger than the venules. We have smaller size and medium size veins. And the most interesting aspect of the veins, because the pressure is low, I mean, it's very easy for the heart to push the blood further. I mean, the blood is the pump, right? But now you get to the capillaries and the pressure drops to about 4 or 5. And now your job is to bring that blood back to the heart. Well, there is no physical pump. Yes, there is. It's called your muscles. We'll see that in a little bit. But you see, the veins have the task of bringing the blood back in the absence of a major pump like the heart. So they have to improvise. They have to utilize the muscles around it. They have to have valves in, because the blood that goes up, you don't want it to go down again. Think of the blood that's in your feet, how you are bringing it back to your heart. So there are different factors that will allow that. Number one is the valves. If the valves are there, any blood that goes forward cannot go backward. So that's good. The other thing is that the muscles, as they contract when you are walking, they will push the blood further Because the blood, remember, in the veins will take a unidirectional flow. It doesn't go back. Why doesn't it go back? Because the veins are the only blood vessels outside the heart that have valves inside them. Okay? And they will utilize the skeletal pump. What is a skeletal pump? Well, if you think about the veins and the deep veins, not the veins that are in the skin, we will see together in the lecture that we have two different types of veins. One is the superficial or the subcutaneous veins, and we have the deep veins. And the deep veins are generally situated between muscles, and those muscles, as they contract, they're going to squeeze on the vein. But wait a second, the blood cannot go into this direction because of the valve, and the blood will only be forced into this direction because that's the direction to the heart. This is great. But what happens if these valves are damaged? Well, then the blood can go back and forth, back and forth, back and forth, so it's going to end up lingering much longer inside your veins, and that will cause problems. For example, as you can see here, varicose veins. And that generally arises in people with history in the job or at home, standing for too long hours. And now what happened here is that you have destroyed the valves that will make sure or ensure that the blood is going into this direction only and not backwards. So the blood doesn't know what to do. It goes forward, goes backward, goes forward, goes backward, and sometimes it just stays here and it says, you know what, I'm not going to do anything. And if the blood stays here, then it coagulates, and that's a problem. If it coagulates, it can get infected and can get into a lot of clinical problems. And we call this situation here varicose veins. Varicose veins. It can also happen in the genitals, but it's very, very common to happen in the lower extremities, and that is because of the gravitational effect. Of course, remember, the blood is supposed to go all the way up and utilize the smooth, not the smooth muscles, the skeletal muscles to push the blood up to the heart. And in the absence of skeletal muscle activity, if the person is standing for too long, it's very, very common to have this kind of effect on damaging the valves in the blood vessels, in the superficial blood vessels, especially the valves that connect the superficial and the deeper blood vessels. As we will study later on, you will have valves connecting, making sure that the blood goes only from the superficial to the deep, but not the opposite way. We'll talk about that when we talk about specific types of the circulation. So anyways, what I want you to remember and realize is that the veins have the task of pushing the blood back to the heart, and because they don't have much pressure built in them, they will have to utilize other sources, and these resources will be your skeletal muscles. We'll call that the skeletal muscle pump. And to assist the pump in their task, they will have valves, and those valves will permit the blood to go only into a unidirectional flow towards the heart, not back and forth. So again, the veins are the only vessels that has valves inside them, outside the heart, of course. Okay? So I'm going to stop here with the not so appetizing picture of someone with varicose veins, and at the lecture we're going to be focusing more then on lab activities and on how do we connect the dots when it comes to the blood supply of the head and the blood supply of your upper limb and the lower limb and the abdomen. We know, or we learned in the heart chapter, that the blood is being pumped out from the heart through the aorta, but then what happens? How does it get from the aorta to your fingers? How does it get from the aorta to your eyes? We're gonna learn that together, and then we will learn also the opposite direction of the blood flow. How does the blood come back from your tiny little capillaries to the venules, and then it merges together, it converges together into forming the superior and the inferior vena cava, and that will empty, as we learned together in the heart chapter, into your right atrium. So this lecture was intended to give you an overview on the structure of the blood vessels, the arteries, the veins, the capillaries. We learned about the different types of arteries. We learned about the different types of veins, although it wasn't that significant difference between the small size and the medium size vein, and the large size and the medium size. And we learned together about the capillaries, the different types of the capillaries, the continuous capillaries, the fenestrated capillaries, and the sinusoidal capillaries. We learned about the task of the veins to bring back the blood against odds, and that will be aided by the skeletal muscles. It will also be aided by the fact that the veins have valves in them. We learned that the arteries will have what we call the elastic arteries, and these are the major arteries like your common carotid, your brachiocephalic, your aorta, pulmonary artery, the big arteries where you want the elastic recoil to be a major function. We learned about the muscular arteries, where the major thing is the muscle, but the elastic fibers will take two lamina layered, external elastic lamina and internal elastic lamina. We learned about the tunica intima and the tunica externa, and we also learned that the tunica externa is the place that houses your vasa vasorum. So this was an overview of the anatomical component of your blood vessels, and then we will carry in the lectures the different circulatory types. We will have the circulation that goes on in the head and neck, and we'll have the circulation that goes on in the abdomen. So we'll talk about these different aspects of the circulation layer in the lecture. All right, have a good day.